continuation of the humerus. What are the attachment to the upper end of the humerus? So already you know some of the muscles, scapular muscles like supraspinatus, infraspinatus, subscapularis, and also teres major, teres minor muscle. These are all takes origin from the scapula, but these are all crossing toward the shoulder region to form a rotator cuff. That those muscles going to insert at the upper end of the humerus. Now once again I will recap this. This is the head of the humerus. It is rounded head of the humerus. This is the anatomical neck of the humerus. Anatomical neck. This is called the lesser tubercle. This is called the greater tubercle. This is intertubercular sulcus. Here we call the surgical neck. This is the surgical neck of the humerus. Surgical neck of the humerus. See here. This is the surgical neck. Now, what are the muscles? This head, first head, it is going to articulate with the glenoid cavity of the scapula to form a shoulder joint, that is the ball and socket variety of the synovial joint. Next, this is a lesser tubercle. It is a smaller size. It is always present upper end anteriorly. Anteromedially it is present just below this anatomical neck of the humerus, anteromedial side. Next, this is the greater tubercle. It is present anterolateral side. Anterolateral side is there. Between these tubercles, this is intertubercular sulcus or bicipital groove. Bicipital groove, not only in the upper end, it is extends up to the shaft also. Now, what are the muscles inserted in the lesser tubercle and greater tubercle? See here, lesser tubercle mainly insertion of the subscapularis muscle. Subscapular. See here, this is the lesser tubercle. Here, subscapularis muscle insertion. This is the subscapularis muscle insertion. Whereas the greater tubercle, here three muscles attached like a posteriorly. See, this posteriorly like a three muscles like this index finger like a supraspinatus, infraspinatus. This is the infraspinatus, and this is the teres minor muscles, sit muscles. These are called the sit muscles. This is supraspinatus, infraspinatus, teres minor muscle. These are the three muscles make a sit muscle around to posterior surface of the greater tuberosity. These three tendons only make a secondary socket to the shoulder joint, that is called the rotatory cuff. See here, three muscles insertion, greater tuberosity, and one muscle insertion is that is a subscapularis muscle. It is a bipennate muscle. Next, whereas here this is a bicipital groove. In this center or the floor, it having the two lips. This is a medial lip of the intertubercular sulcus. This is the lateral lip of the intertubercular sulcus. Whereas in the center, floor of the intertubercular sulcus. In the floor of this, in the center, that long head of the biceps brachii muscle tendon going upwards and cross to the shoulder joint, that is going to inserted at the supraglenoid tuberosity. Yesterday I told supraglenoid tuberosity. Whereas this two lips gives insertion for lateral lip. This lateral lip gives insertion to, that is the pectoralis major muscle. That he knows, pectoralis major muscle, it takes origin from the sternum, ribs and clavicle, but insertion at the humerus where the lateral lip of the intertubercular sulcus. Next, whereas the medial side, middle lip gives insertion of the teres major, that is the teres major. Here pectoralis major. In the floor region, latissimus dorsi muscle. So in abbreviation, a lady between the two majors, otherwise we are also called a lady between the two males, two like a males. Pectoralis major insertion, teres major insertion, latissimus dorsi insertion. These three are very very important. We are asking in the viva. What are the structures? Lateral side pectoralis major muscle, middle side teres major, in the floor region latissimus dorsi. A lady between the two males. These are the structures attached to the intertubercular sulcus, lesser tubercle and greater tubercle region. Here see, this is a sit muscle, supraspinatus, infraspinatus. Next teres minor, SIT, sit muscles. So these are the structures, muscles inserted to the upper end of the humerus. Also here surgical neck of the humerus, head and the shaft separated by the surgical neck of the humerus, crossed by the axillary nerve. Very frequently asking question in MCQ as well as the viva as well as clinically most important. If the fracture takes place in the surgical neck, axillary nerve is compressed. This is the axillary nerve directly relation with the surgical neck of the humerus. This is most important in viva. Thank you.